I was doing the workout that I'd done a million times before. I was strong enough to do it. In that situation, though, my back went out completely, and I went to the floor and I couldn't get up and I couldn't move. And it was the most agonizing pain I've ever experienced. Couldn't walk. I couldn't get up. And my husband, not now husband, picked me up and pretty much carried me to the truck, and we went to the hospital, and I had a bunch of shots and a bunch of pain medication that made me sick. And we went through that, and nothing was making it better. And ever, so from 2017, March of 2017 until this year, I've been in some form of ongoing back pain. It made me stop working out. I gained weight. I didn't feel good about my appearance. And then it just got worse and worse. And I was also in a difficult job. And I left that job at the beginning of this year. And I thought, well, leaving the job, little time to purge the stress out, that should be enough. And it wasn't enough. And I kept struggling, and it kept getting worse instead of getting better. And I thought, what is going on? I can't keep doing this. I was seeing chiropractors. I've seen medical doctors. I've had x-rays. I've had MRIs. I've had it all. And they were all like, yeah, we can't really see a problem. We don't really see what's wrong with you. And it didn't make sense because I was experiencing excruciating pain that it felt like to me someone had to figure it out. And I joined a new group on Facebook that was about, high vibe living. It was about, and it was a positive group of people. I was excited about it. And someone commented on there about experiencing ongoing chronic back pain and what can I do about that? And Kai Ashley had commented, I heal back pain. I have 100% success rate. And I was like, yeah, right. Okay. And so she said, message me if you want information. So I was one of those that said, okay, fine, I'll bite. I've tried everything else. Fine. You're 100% success rate. Sure. Let's see about that. And so you sent me the video, and I watched it by myself. Everybody was gone. It was like 15 minutes. And it was like, I was like, this is weird as hell. I can't even do this at home. Nobody's here. And I feel so dumb with this tapping and yawning and making noise thing. I'm like, I can't do this. This is weird. But something in me said, you got nothing to lose. Literally, you've tried everything else. Why not try this thing? And so I did the whole 15-minute tapping exercise, and I thought, well, I'll give it a shot. So I messaged Kai about joining the case study, and I did, and we're 6 months in. And after that first session, I felt less pain. After the first round of 3 sessions we did, I definitely knew something was shifting and I was getting better. And we've done, I think, 3 rounds of 3 sessions now, I think. And in that 6-month period. And I know that I've made a lot of progress and a lot of change. When I sit down and try to quantify it, it's hard because I have put together all the things that I've done in that time frame. But really, I think the most transformative process for me was going through the heart and soul healing sessions, which at first I really thought were like, there's no way. And she's not lying.
I really loved how it was. I think it was just after 3 or 4 sessions, you told me that you'd started back at yoga again. And I think before you weren't able to do yoga.
Mm-hmm. There was a lot of things. I wasn't able to do most things physically because there was a pain in my lower left hip, kind of like right in the pelvic region. It just prevented me from doing a lot of things. I didn't lift things. I didn't do a lot of things physically anymore because I really felt like I couldn't do them. I physically felt like I couldn't do them. And I kept thinking to myself, I am too young to feel this old. I felt like an 80-year-old person trapped in a 40-year-old body. And I thought, I can't do this. I can't live like this. I also wasn't sleeping. That was another big thing that shifted for me. I wasn't sleeping. I started having trouble sleeping in about August of 2019. Mm-hmm. And before that, I was like, I would be asleep within 17 seconds. I laid my head down on a pillow and I'd start to count to see how long it took. And I could never even get to 17 before I was asleep. And I would sleep through the night until my alarm went off until about August of 2019. And then that shifted. And so I feel like all the way along, my body was giving me signals. Like I just didn't know what they were. I didn't know that they were trying to communicate something else to me. And I've since learned that pain and those feelings and the lack of sleep was all driven by unmanaged, unfelt feelings trapped in my body that I didn't know about. I knew that I didn't really feel my feelings, but I didn't realize that they could do what they were doing in my physical body. I would, in my mind, I pictured, oh, there's a feeling, there's something happening. Let me take a box and open it up and throw it in there, not put a label on it and throw it up on a shelf. And so I had rows and rows and rows of shelves of boxes, unlabeled boxes in my head that were like, that's what we do. That's where they go. All of it, whether it was my feelings, someone else's feelings, I was just holding on to a lot of feeling. And this year, the year of between 2020 and 2021, those boxes started rattling, and then they started falling off the shelf and busting open. And I think that all those feelings just then started flooding, and I had no idea what they were because they had no names, and they just were taking their toll.
Yeah. Yeah. And so I know this sort of sounds like a bit of an obvious question, but could you talk a little bit about how your back pain was before compared to how it is now?
Well, every day when I woke up for several months, I had to do a series of just stretches just to be able to physically get out of bed. I set my alarm, or I wake up at least a good 30 minutes before I even have to get out of my bed, because I had to do stretches and whatnot to feel like I could move, to make my body like physically move, because it was so sore. And now I don't feel that anymore. And when I do notice, oh, I feel a little pain in this hip or that hip or this spot in the middle of my back, and I go, oh, wait a minute, that means something. What does that mean? And I check in with myself and say, oh, I'm feeling this way. I'm in a situation where I feel emotionally unsafe, or I don't feel, which makes me feel insecure. And that brings up that feeling, those feelings in that spot. And I can go, oh, okay, I know what that is now. And I can talk myself through that. I can say, you're safe now. You're not in that place. You're not, everything is fine. And just doing that simple exercise actually the pain goes, okay, we're good now. And it subsides and it goes away. So I've gotten back to, I mean, I started lifting weights again. Which I was not doing before. I can do squats again, which before I was like, nope, I can't do that, because that's what I did when I was injured the first time in 2017. I was doing a squat. And so the thought of doing a squat, I was terrified. I was like, oh, nope, can't do that. I can't do that. And of course, if I told myself I can't, then I can't. And my body responded, nope, yep, we're in pain. We can't do that. We're not doing that. And that's not the case anymore.
That's amazing. So, what would you say to anyone that's thinking that they want to heal their back pain or any sort of pain that they've got, but is unsure if this will work for them?
That you'll know when it's time for you, when you realize I've tried everything and there's literally nothing else, and I'm crying on the bathroom floor saying I cannot live like this, and someone's asking me if you're suicidal, and I'm saying no, I'm not suicidal, I just physically can't do this anymore, I can't live like this. That's when you'll give it a try. And I would hope for people that they wouldn't wait that long, because you don't have to wait that long. I talk to people now who are like, oh, I just am in this pain, I've had this pain, and I'm like, well, one thing I've learned in my process is that chronic ongoing pain is often, I can't say that it's always, like, because I don't want to minimize people who deal with really significant issues, and I'm in no position to say that, but that it very likely could be emotions trapped in the body that you're not learning that, and you have to learn how to feel those. And when you learn how to feel those, then you'll start to heal the rest of yourself.
Yeah, that's so powerful. Well, thank you so much for sharing. That means a lot, because I know, it seems a bit woo woo and like it couldn't even be a thing because it feels so physical. But I think this is going to help a lot of people realize that there really is hope and that there is an answer for them.
I would say that it's super woo woo. And what I've found this year is that the woo woo is what has helped me. It's not traditional going to the doctor and getting a prescription and this and that's worked for me this year. It's the woo woo. It's the things that are outside the norms, the things that I might have before rolled my eyes at and said, oh yeah, okay. Like the thing that I did roll my eyes at was like, yeah, this is going to work. And I'm like, I feel like an idiot here. And when I do my sessions, I do make sure no one else is in the house. I make sure no one else is going to be coming home. I make it clear to people I'm in a session. Do not bother me. Do not interrupt me. Because otherwise I'm feeling a little bit self-conscious. Otherwise I don't want people listening to me making noises and sounds that come with doing the work. But that does distract me a little bit. So it's something that my family would tell you, they notice it too. When I say I have a session, they're like, okay, cool. All right, Ma, well, I won't be home then. Okay. Do you need me to leave? Do you need me to go somewhere? Like they respect that. And, it might feel silly. It will feel silly. I can almost guarantee it will feel silly in the beginning, and you'll feel weird. And like, here's this person I'm doing this with and they're watching me. I close my eyes because it makes me feel better about it. Like for a minute, I can feel like there was no one else there. I just hear your voice in the background. But now I don't really care as much because I know that it works, and the woo woo is where it's at.
Yay. So wonderful. That's amazing. That, did you say it was after 4 years that now you've got the relief?
4 years of being in pain and 2 years of not sleeping. And I'm now sleeping again. And I won't say never in pain, but I have manageable pain that I can work through when I experience it now.
That's amazing. And then when it does happen, anytime we do a session, it just whoop, goes away again.
That's right. And I guess I would even say that we started our sessions. We did our first round of 3 sessions, and then I had an accident this summer. I had a boating accident, and as I had that boating accident, there was actually I heard, and I would say felt communication that was okay. When I came to you as feelings, you ignored me and stuffed me away. When I came to you as pain, you figured out how to manage that pain, but you're still not feeling your feelings, and you need to learn the lesson. And
Mm.
so I was in a lot of pain having this accident, laying on a dock with sunglasses sticking in my forehead and a broken arm. And I'm going, okay, I'm going to be in pain, but it's going to be okay. And what actually ended up happening out of that is I was in a lot of pain. I broke my arm. I had sunglasses sticking out of my forehead. I still have a bruise on my bone on my leg that still causes pain. But at the same time, I healed faster than I've ever healed in my life. I have one tiny scar on my face where I should have multiple scars. I went to one physical therapy appointment, and then I went back for the follow-up, and she said, you're discharged. You've got full range of motion completely. I should have been in occupational therapy for weeks, and I didn't even, by the time I started occupational therapy, I was pretty much healed. My body healed extraordinarily fast through something that I think it was the first broken bone that I ever had, and it healed in less time than they expected. And she was like, yeah, you're good. You're done. So,
Wow,
I
that's
mean, it was all
amazing.
these things came together, and like it was a bigger thing. I realized a lot more about myself and about where how I fit in the universe, which I didn't used to think about so much. And now I know, like, felt like the universe is giving me a solid message, and I need to learn the lesson this time. And I feel like that was really all of it together. It all came together in the right way.
Yeah, absolutely. And the fact that you were able to remain calm through the whole situation instead of freaking out is real, I think, testament to the work. Because I remember we had a session just before and not long after. And for someone that had just been through that, you were in such a good place, able to actually see the message that it was giving you instead of freaking out. So I thought that was really amazing. Yeah.
Well, there was definitely growth on my part for sure. I was in a different place already by that point. And I think, I've been working with a counselor also, like talk therapy counseling, um, which is absolutely helpful, in no way not, but I know that this process is what really got me to that other side. It was a combination of things, but this is really what got me past moving past that. And I was able to use information interchangeably. When I was
Yeah.
with a counselor, I talked about this. And when I go to my counselor, I say, well, this is one of the things we did in our session the other day. And so all of it together, I think, really helped. But you weren't lying. I doubted you to begin with, but I'm sorry I did that, and I'm glad that I didn't just go, oh yeah, whatever, and ignore it, but I couldn't have ignored it if I wanted to. When you wrote that message there, I was drawn. I said, no, okay, something has to work. Something has to change, because I was really at that point where I cannot physically do this anymore, and I don't have to now.
I love it. Great. Ricky, thank you so much.